Hello, everyone. Welcome to the fifth presentation of the Road to ICOPA 2026. My name is Anastasios Saousis, and I will be moderating this seminar today. This was supposed to be hosted by Marco Lale, but he's in a Italian parasitology meeting this week, so he kindly asked me to present our next speaker. Before we start, I wanted to mention that this is the last seminar focused on the science part of the ICOPA 2026. We are going to have one more session on the 16th of July, 2026, where the two bidders for the next ICOPA 2030 will present their cases. Just to let you know and remind everyone, we have two final bids for ICOPA 2030. One is the Australian bid, and the other one is the Malaysian bid as well. So please come on the 16th of July to see their presentation and answer any questions. Will you please mute everyone? Okay, thank you. And basically, it is my pleasure to present Professor Lucy Robertson, who is a professor at the Norwegian University of Life Sciences in Norway, and she will give a presentation on the burden of food parasites. I wanted to mention that actually Lucy is on her annual leave right now, and she's making she's in a big favor for us to be here and give this presentation. So thank you, Lucy, and the microphone is yours.
Thank you. Though I'm not on annual leave, I'm so that's good.
Okay.
I'm at the coalface. Don't worry, no annual leave. But from this evening, yeah, and it's only one day. Yeah, it's not the whole annual leave. Oh, okay. Thank you very much for this introduction, and thank you for inviting me to this. I mean, it's kind of funny, the road to ICOPA, because it's not a road I'm traveling on. But anyway, never mind. I was Marco asked if I could say something about foodborne parasites, and since the WHO have just released the new estimates of the burden of foodborne diseases, I thought this would be a quite topical thing to talk about. And if you happen to be at the WHO webinar, you may as well leave now because it's kind of similar. Okay, so the burden of foodborne parasites. Do the new data indicate new priorities? Oh, I'm trying to go to the next slide and it's not working. Oh no. There we go. I can do it with the wheel. Okay. That's a bit annoying. Never mind. Okay, so you may be familiar with this paper from 2014, published December 2015, sorry, which was the World Health Organization estimates of foodborne parasitic diseases for 2010. A data synthesis was done by this group, Foodborne Epidemiology Reference Group for WHO. And this has now been updated. Oh, I have to use the wheel. This is so annoying. So, and this was published really very recently, this month, June 2026. It's a little bit different. It's an update, but it includes national as well as global and regional data. And it's not just for a single year. It goes from 2000, as you see. Let me try and use this pointy thing. You see this one, is it? Oh, good grief, there's too many choices. I wanted to just use the, yeah. Oh, no, not that. Ha, this one maybe. Huh, I can't. Okay, let's get out of this. I was trying to do a sort of pointer thing, but I can use the mouse, right? Yeah, it goes from 2020 to this. The new data go from 2000 to 2021 rather than just being in a single year of 2010. Okay, I have to use the wheel unless this is working now. No, it's not. So here are two handsome guys about to start having dinner. And to illustrate, the foodborne disease is generally globally important, resulting in considerable morbidity and mortality. They're often, usually when people say they have food poisoning, they're often considered to be due to bacterial pathogens or toxins, usually causing diarrhea within a short time, maybe hours or days after they have eaten something which is dodgy. But there's a lot of parasitic diseases that are 100% transmitted via food, and various others that can be transmitted by food and also other routes. And so although some parasites cause diarrhea within a short period, others do not cause immediate symptoms at all, and they may persist in the body for years or decades before there are symptoms. And they may cause something really very nasty. Some can cause severe chronic conditions such as epilepsy, such as blindness, liver cancer, and congenital disorders. So they are an important issue. It's not, foodborne diseases are not just bacterial. I'm finding this hard to do. Okay. Indeed, foodborne parasites often have the greatest impact in marginalized rural communities with poor sanitation. And parasites are often focal. They're usually clustered, or often, not always, clustered, it depends on the parasite, within geographical areas or associated with a specific cultural dietary habit, or eating raw fish, eating a particular sort of raw meat. Here you see, actually, I was just in Ethiopia last month, and this is a dinner for many people that we were having, and there's a lot of raw meat here. It's the thing that they eat in Ethiopia, and no big surprise, they have a lot of Taenia saginata. So estimating the burden of disease, it's going to support interventions to reduce the impact of these diseases and provide a basis for comparison of such interactions. So you can ask the questions of how much, where, who, and why. And that's what the burden is trying to address. How much of burden is due to this or that parasite? Where does it occur? Who are the people who are affected? And why does it happen? What is the drivers? Okay. So when we started this new estimates of the foodborne burden of disease on parasites, we had to decide which parasites to choose. So we had some criteria because there was not just enough money to do all the parasites that there are which can be foodborne. So we looked at the health burden per case in DALIs, the extent of foodborne transmission, the frequency of human infection. We also thought about zoonotic effects and thought about the Z-DALI. I will say a little more about DALIs in a minute. Economic aspects, how much does it cost to treat people? Economic aspects because of the effect on trade, and economic impacts because of the effect on livestock health. Oops. And these are all the parasites. Not all the parasites we considered, actually, you'll just see, but divided into groups: systemic protozoa, helminths, cestodes, helminths, nematodes, helminths, trematodes. And these are the scores from the ranking criteria. And then we had a cutoff, and we said we should include all those over a certain cutoff. And some of them were not included in the previous estimates, these 5. I guess that those of you who are fond of protozoa will be wondering where the intestinal protozoa, which of course I am very fond of, will be wondering where they are. And these parasites here we are considering were to be covered by the Parasitic Diseases Task Force, whereas the enteric protozoa was in the Enteric Diseases Task Force. They had a different method of doing it, and therefore of getting the data together and making the estimates of the DALIs. So the intestinal protozoa were given over to those people who were dealing with other enteric foodborne pathogens, such as Salmonella, Campylobacter, norovirus, hepatitis, and so forth. So you can see that we had made some new recommendations, and one of these was Trypanosoma cruzi up here, which is included in the new estimates. And there was also 1, 2, 3, 4, which we recommended to include, but they were not included. Taenia saginata was not included because although it's very important for trade, the health burden is low. Angiostrongylus was not included because there is not enough data about foodborne infection. And for the last two, Anisakid genera and Toxocara species, there was simply not enough money, resources to do that, for paying the external people to do systematic reviews. So we were with the ones of the new ones, which we said include, only one of them was included, and then all these ones in blue. So let's see, I'm finding it very hard. Okay, so how do you begin to estimate the burden from foodborne parasitic infections? What is the way? Well, the metric we used is the disability adjusted life year, healthy life years lost due to diseases or risk factors. You are probably all familiar with it because it's really commonly used, but just to give a quick overview. So you calculate the DALI by adding the years lived with disability, which is adjusted for severity, and together with the number of years of life lost due to premature mortality. You die early due to this foodborne parasite. And how do you calculate the years lived with disability? So it's a product of the number of incident cases and the average duration, that is until the person dies or gets better, and the disability weight. So the reduction in the health-related quality of life on a scale from 0, so no real impact at all, so then that would be no, 0 there, to dying, so that's 1. Obviously, you can't get worse than that. And the years of life lost, so that's because you've died early, product of the number of deaths, and average remaining life expectancy at death. So you can just see it here. This person who died at 60, when for this person the average life expectancy was 93. So the years of life lost is 33, right? And then they also lived with this disease for 20 years. So that's and it's given this number of the disability weight. So that's basically what was done to calculate the disability adjusted life years, the DALIs. But first you have to get these data to put into it. So that was another task again. We had a computational task force who was, oh, I think I skipped one. No, maybe not. Yeah, okay, well, let's see. This was the computational framework for all foodborne infections. It was not, or not even, or foodborne hazards, was not even I'm not just talking about parasites here. I'm not even talking about infections here, because this project also involved looking at chemicals, foodborne chemicals, which of course also kill people. And basically, the data collection started here with working out the number of the incidents, the deaths, the severity by country and by year. These data were collected by systematic reviews. The data was cleaned. Of course, there is not data for everywhere, and so data gaps were filled by using imputation, borrowing data from adjacent or similar countries or region. And then looking at with the data set, which is filled, the disability weights, the population data, the life expectancy data per country to give a burden assessment, a total burden estimates. And then, of course, not all pathogens are necessarily only transmitted by food. So it was source attribution. It was based on a CJ, whatever, I can't write. Structured expert judgment was used to estimate the proportion of a of a disease which is foodborne, for diseases which can be transmitted by other routes. For example, I don't know, if we think of toxoplasma, for example, I mean, it doesn't have to be transmitted by food. It can be transmitted by water, for example, which was not included here. Okay. Oops, going the wrong way. So this was done by the computational task force, but the actual modeling was done by Cianzano, the Belgian Institute for Health. So we had the model, the framework for doing this effort was done by another task force in the FERG, but the actual data handling and the actually making up the code was done by Cianzano. The parasites are a little bit difficult. That is that there was the general overview, but there's, for example, this focalized distribution, which is common for many parasites. So you have to adjust for areas and or for subpopulations. Not everybody in an area or a country necessarily has the same likelihood of exposure. And another thing with parasites is that you may only have a small proportion which is symptomatic, even though somebody is infected. You can think, for example, of Ascaris, where if you only have one Ascaris worm, you truly do not have ascariasis. So it's the symptomatic proportion. So this was all done, as I mentioned, by Cianzano. Oops, going the wrong way. So leaping on to the results of all this, I just gave you a very small overview of how it was done. It kind of, yeah, but definitely from an overarching point of view. This is kind of one of the main outputs. So it's the box plot comparing the relative mean foodborne DALYs per parasite infection in 2021. And there are the also uncertainty intervals. So we have the DALYs up here, foodborne DALYs, and then different parasites here. So the main thing, or the main sort of points to get away from this, is that we have Taenia solium at the top, and this is due to cysticercosis. Cysticercosis, or epilepsy due to cysticercosis, was what the systematic review looked at, because this really has the heaviest burden. Taeniosis due to Taenia solium in a person actually gives very little burden. But the potential for cysticercosis is the important thing. And it is this, if you are familiar with that previous one published in 2015, it was the highest there as well. Clonorchis sinensis, this is the second highest one. It also, again, it was high in 2015 and still high now today in this 2021. Well, obviously that's 5 years ago, but that's where we went up to. Continues to exert a heavy burden. But what is interesting with Clonorchis is it has a very restricted distribution globally. Anyway, more on that later. Toxoplasma was the number 3 one. Toxoplasma acquired, and we have Toxoplasma congenital. These were dealt separately. And, you know, Toxoplasma is basically everywhere. So although acquired toxoplasmosis generally, not always, but usually doesn't have a very high individual burden, because there's so much of it added together, the global burden is quite high. Looking at the other end of the scale, down here we have Trichinella, and it was the lowest in the previous FERG estimates. However, it's kind of interesting because we put a lot of effort in Europe, at least, to looking at Trichinella, and one can argue that's the reason why it's so low, of course, because of all that effort. But at the same time, it does make one feel maybe we could work harder on bringing others down to this low level. And then just lastly, because this was not included in the last one, and Trypanosoma cruzi is one of my favorites, it also, even though it was not included in the previous estimates, it had a really high burden. And again, it has a restricted distribution, which is kind of interesting. It was higher than I expected it to be. Okay. Now this is I don't want you to concentrate on this table at all. It's a bit busy because I'm going to talk about regions. The regions in which we use are based on the WHO and what's it called? World Bank classification. So African region of the Americas, Southeast Asia, European, Eastern Mediterranean, and Western Pacific region. And then this is sub-regional clusters, and this is based on their economic status. Sometimes, however, it's a bit political, I guess. Indonesia has now recently, last year in 2025, was reassigned to the Western Pacific region. Ta-dang! However, when we did these estimates, it was in the Southeast Asia region. So this is something just to be aware of, but it's not necessarily what you would think these always are, how you would expect it to be divided up. So this is just so that you can refer to these in terms of when I mention about regions. Oops, wrong way. So, and here we have the regions. So these bar charts show each of the 6 regions and the parasites, giving the foodborne disability adjusted life years, so foodborne DALYs. And what you can see immediately from this is the highest region, or the region with the highest foodborne DALYs from parasites, is the Americas. That's North America and South America. And you can see that it is largely driven by Chagas disease, Trypanosoma cruzi. So that gives the highest amount. Western Pacific region is in second place, and that's largely due to clonochiasis, which is here. In Africa and Southeast Asia region, they are pretty similar. Pretty similar not only in size of the foodborne DALY's rate, so it's rate per 100,000 people. So we can't say anything about it. It's not the number, it's the rate, so it's nothing to do with the population size. It was mostly due to cysticercosis, so the red one, so from Tediosolium. And these two, which are the lowest, which is Eastern Mediterranean and European, here it is toxoplasmosis, and these are the smallest ones, smallest rates. This is kind of the same information put in a different way, to be quite honest. This is the top 5 per region. So what are the top 5 parasites per region? So it's got a similar message to the previous figure, but you can see a little more clearly maybe that so you have Teniosolium in the top 2, we already saw that, but also important to see it's also there in WPR as for Western Pacific region, and also in the Americas as important, in the top 5 of the foodborne parasites giving the highest burden. Chagas disease, as you would expect, is only in AMR, Americas region. Here we were talking only about endemic foodborne transmission, because of course, as you probably know, you get a lot of, well, not a lot, but there is a significant amount of Chagas disease in Spain from immigrants, but they, of course, were not infected in Spain. They have brought the disease with them. It's a little bit tricky is where you want to say the burden is, because the burden is a weight. It's a weight on health services. So people coming to a different country also bring that weight, but also the weight is on themselves. Clonochiasis, which is this pale green color, only in WPR, Western Pacific region, but they're exerting the highest burden. And the last 2, toxoplasmosis acquired, highest there, but toxoplasmosis comes in every, did somebody put their hand up or it went away again? In every region, I think. You see, it's high up here. This is congenital. Yeah, it's in every region apart from Western Pacific region as being one of the highest burdens. You can stop me if there's a question ongoing. Oh, okay, I'll just carry on then. I also mentioned that we looked at time trends from 2000 to 2020. So this is changes. These graphs show mortality per 100,000, mortality rate. And so if you look at the black line, this is the global, this is putting all the regions together, and you can see there's a really minor decrease in mortality due to foodborne parasites over this 20-year period. So although we think we're doing well, we're not doing that well. The good news is that in the Americas region, there really is actually been a substantial decrease over this 20-year period. And also in Southeast Asian region, there has been some moderate decrease. In African region, not a lot of decrease, small. And in Eastern Mediterranean region and European region, where the death rates are the lowest anyway, the decrease is there, at least for EMR, but kind of not even visible for in Europe. So these are more or less the same. But the bad news is this red line, as you'll probably notice straight away, which is in WPR, where in fact the mortality rate appears to be rising over time. We also, I mean, you can obviously, once you have this data, you can do all kinds of fun stuff looking at it in different ways. So this is looking at the foodborne DALYs per 100,000 over time by region, due to parasites, not foodborne in general. This is just foodborne parasites and not those enteric protozoa. So in general, we look at the black line, the foodborne DALYs are indeed falling over the past 2 decades, staying constant in Europe. But the main point again is in the WPR. And in the Western Pacific region, we can see that in 2021, the foodborne DALYs is higher now, or in 2021, than it was in 2012. So obviously the question arises, what is the driver for the increasing burden and the mortality from foodborne invasive parasites in WPR? Why is it going up? What is happening here? Another way of looking at the data, we were not only looking at global and regional, we also looked at actually the very individual countries. And I'd just like to say that every country was informed in advance, or actually had a chance to look at the data for their country alone and provide feedback in saying they disagreed, or maybe they had some internal data that they wanted to share to include. But you get a kind of view here. There's a lot of dark purple, which is Toxoplasma. That's reflecting that it's kind of everywhere. Toxoplasma gondii acquired. But you can see also, and also you can see the Taenia solium, very important. You can see different patterns. What you may like to look here is the orange, which is a Clonorchis in China and in Vietnam. And Korea as well, actually. Yeah. So that's the highest burden by country. So you can spot your own country. So here we find Norway, and it's the highest burden, foodborne burden is from acquired toxoplasmosis. Another thing we looked at is kind of the ranking. I mean, again, it's another way of looking at the similar sort of data. But what one can say is that the 3 lowest ranked parasites really didn't change between 2000 to 2021. So Echinococcus multiflorus, Opistorchis philenius, and Trichinella species they stayed in the bottom, least high ranked in terms of burden. And also the highest ranked parasite stayed the same. This is at the global level, obviously. But there are some notable changes. Both toxoplasmosis congenital and acquired have gone leaping up as becoming more important. And also Clonorchis has gone from number 7 to number 2. While other trematode rankings like Paragonomus and Fasciola here includes Fasciola species and Fasciolopsis, are falling. So just to sum up that whole thing, it's a little bit much to take on. These are just like the summary and some limitations of the results, because I'm going to just give a little bit afterwards on some thoughts based on some of the parasites. So foodborne invasive parasites continue to impose a considerable health burden. Cysticercosis, so from Taenia solium, which should be eradicable. I mean, it's really a parasite which is, because of its 2-host life cycle, we should be able to stop them one going to the other. But it still contributes substantially to global burden in several world regions. Many parasites have a restricted geographical distribution. They can be even localized within a country, but nevertheless, they make a global impact. And that's Chagas disease, restricted to AMR, but exerts globally as a substantial burden, and clonochiasis, restricted to WPR, but again, a substantial burden, which is increasing. Acquired toxa, globally distributed, and therefore a widespread burden. But obviously, these are estimates. That's one thing to say, which is really important. They are estimates based on data, but they are estimates. And we appreciate that they have shortcomings and that they are incomplete. We also appreciate that it's annoying that for some parasites which we considered important, we weren't able to make an estimate for them. And people who are specialists in Anisakis have complained about it, and Toxocara in particular. I've heard negative feedback on that, but yeah, we wanted to, but it was not possible. We also couldn't include all sequelae for all parasitosis, and that was also a bit of a shame. For example, for Taenia solium, we could have increased the burden even more just by headache, in fact, or other things like that, or for toxoplasmosis, we were trying to look into doing some looking in specifically at in acquired toxoplasmosis, psychiatric syndromes. Anyway, despite there also you can probably find other shortcomings and gaps And that's to be expected. And it is important to repeat that they are estimates and there is modeling. And yeah, all models are wrong, but some are useful, and we hope this one is useful. Anyway, they still provide an updated baseline that can drive targeted disease-specific interventions, and that we can evaluate by looking later using the same method of how whether the interventions have been successful or not. So just using the data, so Clonorchis, because this was quite an interesting one. So here's a map which is showing clonorchiasis. The burden is heavy and rising. So just for clonorchiasis, with this map. And you can see that the place where the highest rate of DALIs is actually here, which is Vietnam. It's also pretty high in China, and then we have some in Russia. Those are the sort of, I mean, we have some other places here, but the highest per 100,000 people is definitely in Vietnam. So we were discussing with people from there who have significant knowledge, bunch of Sripa and many others who are specialists in this foodborne trematodes. What could be the drivers? So climate and environmental change affecting transmission dynamics, affecting fish host populations, and affecting snail distribution patterns is one thing which appears to be important. But also urbanization, food movement, land use, and infrastructure changes. There's a lot more aquaculture going on there now, more dam construction, more cyprinid fish. So this is being eaten. And shifts in socioeconomics, which is altering food product movement and also consumption patterns. So these are all sort of areas to target. And I just wanted to add that this part of which I'm presenting to you now was actually when this was a lot of everything I've said so far. It was part of the WHO webinar. This part, and with myself and others who were specialists in the certain areas presenting them. This part was not presented by somebody who was in FERG, who were doing these, working in this project, but it was Bernadette Abella. She is a neglected tropical diseases lady. So these she has discussed in her group at WHO. Hello? Okay. So learning potential is, there's been a lot of education control of opisthorchiasis in Southeast Asian region, specifically Thailand and Cambodia. So learning potential from One Health approaches used there is something. Trypanosoma cruzi, again, this was another big one. And this is the map, which is showing where it's concentrated. Heavy burden, 5,740 deaths and 522,000 DALIs. And you can see in specific countries like Venezuela and this is Bolivia have a really heavy burden. Why is it so high? People keep asking. You know, I'm sure you know that usually or traditionally we think of Chagas disease as being a vector-borne disease. But when you have the vector-borne transmission, actually, people who are infected by the vector-borne route don't usually suffer from the acute phase of disease. You know, the disease is in two phases, acute and chronic, and usually with vector-borne, there's very little acute disease. But in foodborne transmission, there is. And there's many reasons behind that, including immunology, the route it goes into the body. There's also the vectorial shifts may favor foodborne transmission. If you remember the vector-borne transmission, the reduvid bug, which is the vector, actually defecates after feeding on a person. They defecate round or near the wound or on the person, and that's where the parasite is. But not all vectors actually defecate straight after feeding. And there's been a shift towards these other ones, which makes foodborne transmission more likely, where the vectors may actually end up in like fruit juice or something. And also there has been more recognition of outbreaks, particularly with these artisanal, as they call them, juices. So this is kind of a very interesting, and I'm glad that we could shed a bit more focus on this foodborne transmission route, which is something. There's been a lot of activity, excellent, of course, by PAHO on reducing vector-borne transmission, specifically by trying to ensure that people do not have reduvid bugs living in their houses and ensuring that biting at night is reduced. But there is another branch to be done here. Taenia solium, yep. So this is cysticercosis, and you can see this is the, again, there are certain countries in particular which have a really heavy burden, like DRC, for example, if they didn't have enough problems already. Madagascar is another one, and there's been a lot of work done in Madagascar on reducing cysticercosis. So the Madagascar mapping indicates how to plan and prioritize. This is a big WHO project, so treating both people and pigs, vaccinating pigs. Obviously, a pig is only infected if it eats the feces or the eggs from the feces of an infected person. So water and sanitation is really important, that pigs actually can't manage to eat the feces or the eggs from the feces of an infected person. And obviously these are education, advocacy, and resource mobilization is important for all these actually rather neglected diseases. So I think I'm running out of time, but I need to finish by saying some acknowledgements and also where you can get some extra information if you're interested. So as I said, much of this was presented at the WHO webinar on June 17th. So I need to thank Yuki Minato from WHO, who put the webinar together, Paul Torgerson, who did the kind of introduction, Brecht Devleschwar, I cannot say that very well, from Cienzano, who gave the overview of the model, and Bernadette Abela, who was concentrating on the last part. I mainly presented the results. And this presentation is also available in YouTube. I don't know whether it's there yet. It wasn't when I looked the other day, but there is many of these FERG outputs which are now on which are having webinars, and the first one, which was the sort of overarching one, which is not just parasites, but it's on the enteric diseases. So there you will find the Crypto, Giardia, Entamoeba, one more, Cyclospora, that was new, this rendition there. So you can look at that, it's the overarching one, but there are also ones for the separate ones. This FERG was a big community effort. We are actually not so many authors, 20 authors for this effort, but the acknowledgements list takes like 2 pages because a lot of people contributed in insufficient to be authors, but still contributed. And everybody as author here contributed more than enough. The data collected for the study, and this is kind of interesting, it's publicly available. And you can go into this link, and it's an interactive dashboard, so that you can explore the parasites or the other pathogens which you are interested in. You can look at how many children, under 5s, over 5s, where, which region, DALIs, years of life lost due to disability, those which are foodborne, those which are not foodborne. There's a lot of stuff there, so it's a really fun, nice interactive dashboard. And also, if you're interested in how the coding was done, that is also available. So it's really a very transparent activity. So despite all its, I'm sure there's many errors, and the results are not the right results. They're just the closest estimates we could get with the data available. It's very open about where the numbers come from. So that I think is a good thing. If you have any questions, that's all from me. So thank you for the opportunity.
Brilliant. Thank you. Thank you, Lucy. I will stop the recording now, so we can allow to have questions. But just to remind everyone, for the YouTube channel, this was the last seminar of the ICOPA 20 to the lot of ICOPA 2026. The next seminar will include presentation from the 2 bits of ICOPA 2030 and will take place on the, just to confirm, on the 16th of July at 7 a.m. UK time, or 8 a.m. European time. Okay, and